The Resident Doctors Association of Zambia has bemoaned the lack of manpower in health facilities, especially towards the fight against COVID-19. The World Health Organization standard doctor-to-patient ratio is 1 to 1,000. However, in Zambia, this stands at 1 to 12,000. Association President Dr. Isaac Sakala says there is need to increase human capital in health facilities as the health system is overburdened.
As an association, we're calling for, I think, the recruitment of more healthcare workers. I think there will be no better time than this one, especially now that we're experiencing a surge in the number of COVID-19. And we're glad that there are about enough doctors. We have about 400 doctors who are in the street awaiting employment.
He says with the coming of COVID-19, the situation has been made worse as when a doctor tests positive to the virus, he or she must withdraw from work and be placed on quarantine, therefore creating a gap in service delivery.
A number of healthcare workers, doctors particularly, have fallen ill. So at a point where we need more hands on the table, some of the doctors have been taken away from the frontline because they are fallen ill of COVID-19. It's at the same point where the number of patients coming into the hospitals has doubled because of the pandemic. So the overwhelming on the part of the doctors and healthcare workers in general has actually doubled because of these two fronts.
He has called on government to the Ministry of Health to ensure the continuous supply of personal protective equipment.
On the part of making sure that the personal protective equipment is available for the healthcare workers as they work in these facilities.
Now the association has further called on government to fulfill its promise of providing incentives for all frontline care workers, something that was announced by the Ministry of Health in 2020.
We also want to see, I think, the welfare of these healthcare workers, I think, looked into further, find means on how to motivate, I think, the healthcare workers and reduce the risks of the burnouts that they're experiencing.
Virginia Chilongo, Movie TV News, Lusaka.